Okay,
Good morning, Walter.
good morning.
Walter is our Chief Operating Officer for Support Solutions of the Mid-South. He is going to tell us about his experience with Plutus. So we'll begin. So, Walter, please introduce yourself, tell us about your role in the organization, and a bit about your background.
I've been with Support Solutions for about 12 years now. And Support Solutions is an organization in Tennessee and North Carolina, and we support difficult to serve people and people with mental health issues, intellectual and developmental disabilities, and behavior issues that need help.
Excellent. So what challenges was Support Solutions facing before we started using Plutus Health, and how did they impact our organization?
Well, we had a few people that a new staff that came on board, and we found that we had some staff that knew parts and bits of credentialing people, and we needed somebody that knew the whole system. And so what we did is we reached out to Plutus to assist us in credentialing our mental health staff and our behavior analyst staff.
So how did we first hear about Plutus, and what made us give them a try?
Well, we had the need, and it was timing. We received an email advertisement from them, and we reached out to them and talked to them about what our needs were.
And so what has the experience with Plutus Health been so far? Can you walk us through the onboarding process and the initial experience?
Well, the onboarding was relatively simple for what we needed, because Plutus is a larger company that provides more services than what we needed, but they did provide this credentialing part, and they walked us through it, what they needed, which was names of our staff and the funding entities that we used. And then they explained the process. Met with us and others. They explain the process and the costs of the program.
Okay. What specific features or services did we find most useful in the journey, and how did we incorporate Plutus Health into the organization?
Well, what we did is we were asking them to help us with the credentialing process, and we had to provide the data to be credentialed, and then they assigned a person, Glenn, who is now feels like a part of Support Solutions family, that has helped us through this step-by-step process. And we've gotten all of our providers, all of our staff credentialed, along with the provider agencies that they bill for.
Excellent. So do you feel that Plutus Health provided a personalized experience tailored to our organization's needs?
Yes, very definitely. Their guidance has walked us through a review of our processes and procedures and needs, and has really helped us identify a better system of gathering the information and then communicating to our funding agencies.
Excellent. So beyond what you've just said, what would you say are the key benefits that you've noticed since using Plutus Health? Any specific examples or organizational improvements or positive changes we've experienced?
Well, we don't have multiple people spending time out of their regular work days, and there were more payers for our services than what we really realized. And so we've expanded the services that we provided because of the different insurance agencies that have been identified.
This circumstance, we were just specifically looking for credentialing health, and that's what stood out to us. Is that correct?
Correct.
Okay. So can you share any specific results or metrics based on Plutus's impact on our organization?
The particular features that have helped us with Plutus is that they had their entire team meet with us to explain their process and expectations of both parties, both us and the funding agencies. I feel like that, they had high customer service and are so patient with us. I mean, because again, we were doing it minimally, but they came in and helped us understand what was the process and how did they go through getting us this credentialing with the various insurance companies. And then they also assigned us a guide, which was Glenn. Glenn has worked with us. We meet weekly, and he describes what he's accomplished and what information he needs next.
Excellent. So is there anything else you'd like to share about your experience with Plutus Health?
Not that I can think of. We just feel like everyone should learn more about Plutus and the different services that they provide, and look and see if they can improve their agency by using Plutus.
Well, thank you so much, Walter, and I appreciate your time and talking about Plutus Health.
Okay. Thank you, Carolyn.
Have a great day.
You too. Bye-bye.